Pleased to say the Housing Secretary Robert Jenrick joins us once again in the studio. Minister, good to see you this morning. Shall we start with Christmas? Because clearly it will be something that, well, practically everyone is thinking about, given we're so close to it, but also given the potential that it might not happen. What is the government's position this morning as regards the 5-day window?
Well, we've set out the legal framework, as you say, which is the 5-day window, the ability for 3 households or bubbles to come together if people wish to do so. But we're also saying in guidance that this is a question that everybody needs to think about. And as you say, I think these conversations are happening in households up and down the country this morning. We all need to use our own personal judgment, thinking about our own families, whether we have particularly elderly or clinically vulnerable relatives who might be around that Christmas table, and also looking at the fact that the rates of the virus are rising in many parts of the country. And I think thinking about some of the examples we could see internationally, like Thanksgiving, for example, where lots of people coming together did have consequences after the event. So I would just urge people to use their personal judgment, to think carefully whether this is the right thing for their family and come to their own judgment.
What factors should they be considering then in coming to that decision? 2 strike me straight away, whether or not you'll have older people round the table, and second, and one which is pertinent to my own case, whether or not you have to travel 400 or 500 miles to get to where you want to spend Christmas. Well,
I think those are exactly the sorts of things that people will be discussing, whether or not you've got older relatives, whether the people around the table are likely to be clinically extremely vulnerable. And I think circumstances have changed. I mean, thinking about my own family, a few weeks ago we were, I think, clear that we would meet up because, my mum and dad have been longing to get the family together. I think today, not just because the cases of the virus are rising in some parts of the country, but also because of the good news of the vaccine has changed some people's perspective, because many families think now, well, you know what, by January or February, the elderly members of my family may well be vaccinated, and so why not wait and get the family back together, later on in 2021? And that's the sort of judgment I think people will be making across the country.
But could you be explicit, just for a second? If you have people in the categories that were shielding, for example, during the first part of this pandemic, is it your view that we should not be spending Christmas with them?
Well, we're not telling people how to come to this decision. We can give guidance. The Chief Medical Officer obviously has set out his own views, and he's been clear that he would exercise great caution in bringing people together, particularly those who have certain vulnerabilities. But you can't legislate for every eventuality. You've got to ask people in the end to use their own personal judgment.
Well,
and Christmas is a fairly unique time of year. Many people have been longing to come together. And so we're offering people, obviously, the ability to do that, but asking them to use their own good judgment.
But again, the situation does appear pretty confusing. I mean, take the YouGov Snap poll suggesting, I think it's 57% of people actually think the Christmas window should be dropped. Add into the mix the British Medical Journal, the Health Service Journal, legions of scientists all suggesting that this Christmas bubble will lead directly to a 3rd wave and deaths.
Well, the legal framework, as I say, is there. People have the ability to make use of that if they want to, but no one's being asked to do that. We all have to come to our own judgments. As I say, I suspect that many people's views have actually changed or are changing as they're deciding whether or not this is the right thing actually for their own family. In my own personal circumstances, that's the case. I think many other families across the country are coming to the same judgment.
Do you not understand why this is so
complicated? I don't think the government can legislate for every eventuality. Life is far too complicated for that.
Indeed,
and there are some people,
but you can provide guidance,
people who are actually very vulnerable, who might choose that actually they'd be looking forward to Christmas. They don't know how many more Christmases they've got ahead of them. They want to come together with their family.
No one is denying that there is a divergence of opinion in all of this. I spent half an hour going through our Sky News inbox this morning, and aside from the usual complaints about me being Rab C. Nesbitt, there were definitely 2 camps in all of this. No one is denying that. But it is confusing for the public. On the one hand, you have opened up the Christmas window so that people can spend time with their loved ones. Then we have you, the Health Secretary, and others saying you really need to think carefully about seeing your loved ones over the period. You have people taking their children out of schools so that they can self-isolate, so that they can see their loved ones. And then you've got the Education Secretary forcing the schools to open and telling people to put their kids in. You have to concede it's a confusing picture.
I don't think that's the case. There is a legal framework, that's clear. That's across the whole of the United Kingdom, but it's not compulsory to do that. it's obviously a matter of your own personal judgment. And my instinct is that Christmas is one of those unique occasions where people do want to come to their own judgment about what's right for them and their family. As I say, many people will conclude, I think, that actually it's better to have a smaller group, just your own household, maybe your own household plus one other person who's part of your bubble on this occasion. We've seen many other holidays and celebrations conducted in that way over the course of the year, including other religious festivals from Passover to Diwali for other faiths. So it's certainly something that can be done, has been done, but it's a matter for you to come to your own judgment.
We know that there is a conference call with the devolved nations this morning, but as things stand, the Prime Minister, from what you're saying, is not minded to change anything about the Christmas window.
No, our position is clear, I hope, that the legal framework will continue, but because the rate of infection is rising in many parts of the country, because we can see the international examples like Thanksgiving, it is incumbent on each and every family across the country this morning and in the days ahead to have that conversation around the breakfast table. Is this right for our family? To think about those factors that we've discussed, the particular vulnerabilities of members of your own household and those who would be coming in for Christmas, and come to a judgment.
What is the modelling telling you about how many people may die as a result of the 5-day window?
Well, this is a virus that thrives on social interaction, so bringing more people together, even for this relatively short period of time, it is not cost-free. It will have consequences in terms of increasing the rate of infection.
Please be explicit. People will die.
But these are the sorts of judgments that people need to weigh up. How much do they want to bring members of their broader family together at Christmas, or whether they think on this occasion, let's just keep it small and we can meet up in the spring. You know, Easter can be the new Christmas for some people.
Well, I mean, many people will hear that and see a strong suggestion from the Housing Secretary that actually, guys, maybe you don't want to do Christmas. Do you understand? There are conflicting messages. It is fine for you to say.
No, I think the difference between us with respect is that you want the government to tell everybody what they should be doing at Christmas. And my view is that the government can set a legal framework, and then it's for people to use their good judgment. You can't legislate for every eventuality, particularly something as sensitive as Christmas, where people will come to different judgments based on the vulnerability of their own family and how important this is to them, because there are many people, as I say, who have been longing to get together at the end of a very long and difficult year. And I think we have to respect the fact that people will come to different conclusions. Can
you then give us an update as to how the vaccination programme is going? We have figures for Scotland, we have figures for Northern Ireland. We don't have figures for England again. And once again, we hear reports from doctors, from GP surgeries, that they are doing numbers, ultimately, almost essentially, on the back of a fag packet. They're using scrap bits of paper to try to come to totals. Why do we not yet have a total for England?
Well, we will do soon, but we're going to do it in a sensible way. When we've got the data together, it's properly verified, then we'll publish it. We certainly don't want to be publishing data that we're not 100% confident of. We have rolled out tens of thousands of vaccines, a very large quantity. Of course, as you know, we are the most advanced country in the world at rolling out a medically efficacious vaccine. So we should be very pleased about that. Hundreds of GP surgeries are now taking part in the exercise within England alone. As soon as we have properly verified data, we will publish that, and then we'll begin the process, as we did with other things earlier in the year, of announcing them on a regular basis.
But why are Scotland and Northern Ireland in a position to furnish us with that data and England is not? I mean, it does seem...
Well, we all take different actions in this respect. The most important thing, as far as we're concerned, is that we get the data right. We make sure that it's as accurate as possible. We certainly don't want to have any suggestions that it's not correct, or there's having to be subsequent corrections. And so if members of the public who are interested in this are just able to bear with us for a short period, we'll soon have regular data being reported.
The problem, as I was going to go on to say, is that when it comes to data around COVID, this government does not have a particularly good track record. There were significant problems when it came to reporting mortality numbers. There were significant problems when it came to collating the number of tests that had been carried out. You know, Ed Conway and Roland Manthorpe here discovered that, you know, people were doing the sums on bits of scrap paper. And once again, we find ourselves in a position where the government can't get control of the data. And as you keep telling us, the data is central to the administration of our public health strategy.
Well, I think what you're suggesting is that it actually would be wise to wait a few days or a couple of weeks to make sure that the data is in the right position before we start publishing it. What we do know is that the UK has moved incredibly fast on this topic. We have the first vaccines to be medically approved, and they're being rolled out across the country before any other major country in the world is in the same position. So we've moved at pace, but let's make sure we get the data in the right position before we start publishing it.
How do we sort the problems, though, in collating that data? GP surgeries are reporting that the software through which they are to register the information isn't working, that they're being booted out of it. The spinning wheel of death is appearing on their screen more often than not.
Well, obviously, the Health Secretary and the Department of Health are working very closely with the GP surgeries who are participating. It has been thus far a relatively small number, around 100 GP surgeries, so we're working closely with those. But those numbers are rising very rapidly. You know, they're doubling every couple of days. And so the important thing now is that we work with those GPs, the fantastic people who are rolling out the vaccine, and we make sure the data's right before we start putting it in the public domain.
I mean, you yourself have mentioned that there are issues. What are those issues?
Well, there's always going to be a degree of teething issues when you launch something as ambitious as a national rollout of the vaccine. But actually, from what I've seen, I'm not the Health Secretary, I'm not as close to it
we should always caveat
some of my colleagues, but from what I've seen thus far, actually this exercise has been a huge success. We've managed to get the vaccine over the line. It's being put into the arms of elderly and vulnerable people across the country, probably as we speak, and bringing hope to people across the country.
Another of your colleagues, Dominic Cummings, once again in the headlines today, reported that he has had a 40% pay rise. What on earth is going on in government that someone hired on 100 grand can get an extra £40,000 in their pay packet?
Well, Dominic Cummings obviously left the government now, but I understand that he was given a pay rise to bring his salary broadly in line with those of his predecessors, other people who'd been
and the Prime Minister.
Chief of Staff to former Prime Ministers. This is a significant amount of money, obviously, but it's in line with, say, the Chief Executive of a medium-sized local council. And the amount of money that we spend on political advisors within government, both this government and its predecessors, is very small by international standards, a very small portion of the amount of money we spend on the broader civil service. And I think they do a good job for us. You know,
40%
it's
pay
an
rise.
important function.
A 40% pay rise.
We are delivering on our promises at general elections, and it ensures the political impartiality of the civil service. So I think special advisors play an important role in our political process, but I completely understand that ensuring pay restraint amongst politicians and the public sector is going to be very important in a time when other people in the private sector are finding their wages squeezed.
Yeah, TV presenters as well. Let's maybe conclude on a topic that will be coming up through the day. Heathrow, third runway. Obviously, we're expecting a decision from the court, so we can't comment on that. But the government is very, very keen to see, you know, the third runway build start.
Well, the government has taken the view under this administration that it's a matter for the private sector. This is a runway that's going to be built and paid for by Heathrow and its partners. And so it was right that if they wanted to pursue this project, it's a massive and important national project, then they pursued it. They've obviously taken this action through the court, and we'll have to see what happens later today.
And on your own brief, it does appear that Conservative backbenchers have won the day, that the shires are not going to be seeing new homes built. Instead, it's once again going to be the cities that will get the benefits and the negative impact of a housing programme.
Well, that's not quite right. All parts of the country are going to be building more homes. We're already building more homes than any government has done since 1987. I want to see that significantly increase in the years ahead, and so that will be happening whether you are Surrey or whether you are Manchester or Stoke-on-Trent. But I do think it is important that we try to direct more of those new homes to our big urban centres. Those are the places where there is generally brownfield land, so we're not building on the countryside. It's where the infrastructure is there. That's the most environmentally sustainable way to build new homes. And COVID has also changed a lot of the dynamics. It's magnified patterns that have existed for some time and given us actually a generational opportunity to repurpose offices and retail for housing. And that's one that the government wants to grasp.
Robert Jenrick, good to have you in the studio this morning. And despite my questions, I do hope you can safely spend some time with your parents this year.
Thank you.